Hello everyone, and welcome to MitoHackers. Thank you for joining us today. It's a pleasure to welcome back again Dr. Francisco Villarreal. Dr. Villarreal is a professor of medicine at the University of California, San Diego, and one of the scientists behind the research into the biological effects of epicatechin. Today's presentation looks at a particularly important period for patients: recovery after surgery. Surgery places substantial stress on the body. Beyond the healing of the surgical site itself, patients can experience weakness, fatigue, loss of physical function, and a difficult return to normal activity. Dr. Villarreal will discuss what happens to mitochondria during this process and research examining whether epicatechin may help restore aspects of mitochondrial function during recovery. His presentation is titled Restorative Effects of Epicatechin in the Recovery of Patients from Surgery, Central Effects on Mitochondria. After the presentation, we'll open it up for discussion and questions. Dr. Francisco, thanks again for joining us. I turn it over to you.
Thank you. So let's see, I'm going to share my screen. Okay, good morning to all. Thank you for joining the seminar. Again, the title is Restorative Effects of Epicatechin in the Recovery of Patients from Surgery and Central Effects of Mitochondria. I'm the Chief Medical Officer for FMG Health Sciences. So select work that is going to be presented in this seminar is derived from almost 2 decades of research led by Dr. Guillermo Ceballos and myself, including a significant number of collaborators and associates, which has generated approximately 70 research articles published in medical journals, index medical journals. And all of these articles are available for easy download on the Mitos website. So this is just an outline of my presentation for today, a little bit about epicatechin science, which has been covered nicely, very nicely by Guillermo Ceballos on the first presentation of this seminar series. So I'll just one quick set of highlights on relating the basics of mitochondrial function and how it relates to the endothelium or blood flow. Then talk a little bit about the biology of surgery. Then move on to factors which can influence the outcome of a surgery. Then also talk about the biology of the recovery from surgery, which is a completely different sort of biology, if you will. Then the role of mitochondria, oxidative stress and inflammation in the setting of surgery. Rehabilitation medicine, and then which are some of its significant challenges, and how is it that epicatechin may act to improve on pre- and post-surgical biology, meaning that they can sort of set up a good framework for somebody who's going to have surgery, and then also improve the recovery from surgery. And then talk a little bit about a potential solution, which would be epicatechin and Mitos, which is containing pure epicatechin. So this is a slide borrowed from Dr. Guillermo Ceballos' presentation, where he highlighted the key importance of 2 systems, of the many systems in human biology that can definitely improve on the health, overall health of our bodies, of our systems, of our organs, tissues, and whatnot. And the top part of the figure here, we have a mitochondria. The mitochondria are present in very large numbers inside of every cell, essentially. And these are the organelles that can take what we eat, elements of what we eat, and transform them into energy. So this is a very important sort of organelle. It's the generator of ATP, which is the source of energy for all of our functions, be it the beating of the heart, brain function, eye function, kidney function, all relies on the production of sufficient amount of ATP. It's healthy amounts of ATP. Now, one of the things that we discussed, which is also important in the context of surgery, is that we humans and all biology, all sort of living beings, tend to lose mitochondrial density as we age. And that can be up to 10 to 15% every decade, starting from our 20s, moving on. So you can see how is it that if we want to be completely healthy or very healthy, very strong, if you will, it's to our advantage to have very healthy mitochondria, sufficient amounts of ATP. However, as we age, there is a consistent loss that we can counter to some extent, but not fully compensate for. And this can be important because most of the surgeries are going to be happening in us as we age because of aging. Let's say the replacement of a hip or something like that. And it's not the same when you operate in somebody who's 20 years old versus somebody who's 70 years old, as you can imagine. Now, intrinsically coupled to the function of adequate function and production of ATP by mitochondria is the function of the endothelial system in the vasculature. So the endothelial cells line the inside of blood vessels, and it is critically important that these cells, which also have mitochondria, function adequately such that blood flow is sufficient and appropriate for all organs and tissues. So as you can imagine, in the context of surgery, we always want to have proper blood flow during surgery, after surgery, because that's going to allow the systems and the organs and the cells to be able to heal, as we will see in the next couple of slides. So just a little brief summary about the biology of surgery. It's a coordinated physiological response to tissue injury, because as we cut, as we remove, as we replace or whatnot, that's a form of tissue injury that is caused by the actual operation. While surgery is ultimately intended to treat disease, it also initiates a highly regulated cell-based cascade that involves hemostasis. Hemostasis is coagulation of the blood. We always want to have blood eventually stop. We create bleeding because of the cuts and whatnot, but we also want to make sure that eventually it stops. Inflammation, there's always swelling, etc., which can be good, but it can also be bad. Activation of the immune system that sets the process of healing, proper metabolism, proper production of ATP so that all tissues and organs are sufficiently generating the energy that they need to heal. A process of tissue repair that ensues, the scarring, if you will, and remodeling, proper remodeling of the tissues that were modified by the surgical process. The magnitude of these responses largely determines how we recover, what kind of complications we may have, and what are the long-term outcomes. And, just for sort of current anecdotes from my friends several of them who are getting their prostate removed. Prostate removal is a very harsh process. There's no good side to it. There's a lot of inflammation, there's bleeding, there's a slow process of healing and repair. So this is sort of a good example of, a severe surgery, sort of a significant surgery in which all of these elements are definitely present there, and all of those eventually need to be balanced such that this person who now has a prostate removed can have a proper function of his urinary system. As we will detail later on, successfully recovery depends on the body's ability to rapidly stop bleeding, I already mentioned that, mount an effective but self-limited inflammatory response. Inflammation is critical because inflammation allows the system to react, be able to repair and remodel, as long as the inflammation is controlled. A repair of damaged tissues already mentioned through a coordinated cellular and molecular mechanisms, and remodel the repaired tissue into a stable scar while restoring normal function. Something that is critically important when you remove the prostate is that there's a lot of tissue injury there, and it needs to heal, and it needs to scar, and it needs to remodel adequately such that this person now has proper urination, if you will. The quality and speed of recovery are determined by the balance between the systems. Again, I already mentioned the systems. So what are the factors that can influence the outcome of a surgery? Favorable outcomes depend on adequate oxygen delivery. So it's really important that in the context of any tissue that is being manipulated through surgery, hip replacement, knee replacement, prostate surgery, breast surgery, etc., that there's adequate blood flow and vascular function. Also, nutrition is critically important, in particular protein. We already mentioned mitochondria, energy production of sufficient amounts of ATP. Controlled inflammation. Inflammation is good as long as it's not sustained and or increased over time. Also, that we start moving the patients, and that's critically important. And that is essential for the body to recognize that it needs to heal, it needs to remodel, it needs to function. Lack of mobility is a very serious problem. Sort of looking at the opposite side of the coin. The absence of complications such as infection or reduced blood flow. Again, those are critical elements. Now, factors that can lead to adverse outcomes, it's advanced age. That's pretty obvious. The presence of chronic diseases such as diabetes or insulin resistance. Inadequate nutrition, which can be a significant problem in older patients. Poor circulation. People that suffer from atherosclerosis, inadequate blood flow to the heart, to other organs, to their lower limbs. Also because they are smokers, and smoking tends to reduce the adequacy of blood flow. Obesity can be a problem, as you can imagine. Anybody who suffers from chronic inflammation to begin with is already not in a better state for outcomes related to surgery. The use of steroids, sometimes you have to be on steroids, but you still need to do surgery. So that's something that the doctors need to balance before the surgery. The use of radiation, for example, you can irradiate breast tissue, you can irradiate, well, usually you don't do surgery on irradiated prostate, but you can in breast tissue, then remove breast tissue or whatnot. That can be also problematic because radiation is essentially burning tissue. So burnt tissue never heals like healthy tissue. Persistent infections. So infections in prostate surgery are relatively common. So you have to manage that. The bleeding is typically a problem. The inflammation is a problem. The healing is a problem. Infections are a problem. So you need to control all of this such that eventually, let's say 1 month after prostate surgery surgical removal, you are restoring normal function. But it's a very painful process, very inconvenient in many cases. Now, a little bit about the biology of the recovery from surgery. We're talking now about the recovery. Some major biological systems involved in the recovery include the vascular system. We already talked about the blood flow, because we need to make sure that blood coagulates, that bleeding is not constantly present, okay? We need, in addition to that, adequate blood flow, and we also need to form new blood vessels. Whenever tissue that was cut and separated, let's say, like in the case of prostate surgery, the urethra, and you reconnect it, you need to make sure that in the reconnection of tissue, there's new blood vessels that are being formed to restore adequate blood flow to that new scarred and remodeled tissue. The immune system, both the innate and adaptive immune responses are critical for the biology of recovery. The endocrine system, because whenever we undergo surgery, it is a very stressful event, and your body senses that, and it needs to control, if you will, hormones such as cortisol that we produce, insulin, catecholamines, glucagon, to be able to adjust to the stressful environment in a proper manner. The nervous system, why? Because, whenever there's injury, whenever there's cutting and replacement of tissues, there's going to be pain. This also creates pain signaling and stress responses. The musculoskeletal system can be very, very important because, if it's a source of mobility, as well, obviously, and on the other hand, it can also represent a source of protein mobilization in the case of patients in which there's already wasting because there's an underlying chronic problem in which the patients are losing weight, and we can't really be able to provide sufficient nutrition for various reasons. So sometimes people tend to use their muscles as a source of protein, which is not a good thing, of course. And then we already mentioned the bioenergetics, the mitochondria, the fact that they produce ATP. And ATP is going to be essential for all of the processes that we mentioned about, for inflammation, for healing, for scarring, for activation of stress responses, etc. Everything depends on the production of ATP, including the production of scar tissue such as collagen, and then also the remodeling of tissue. Now, there are already a known set of interventions that can definitely improve outcomes after surgery. Adequate protein intake, so meaning that we have sufficient nutrition, sufficient amounts of nutrients such that that is not in a negative balance, that we sustain either a neutral balance or a positive balance. The provision of some vitamins and make sure that these patients have or can get sufficient amounts of vitamins and elements like zinc and copper. Adequate blood glucose control in the case of diabetic patients. The fact that there's smoking cessation. So if you go to if you're a smoker now and you go to a surgeon to, let's say, get some work on your eyelids or whatnot because of some issues with either appearance or function of your eyelids, plastic surgeons are not going to operate electively on a patient that is a smoker. They're going to say, you need to stop smoking a few weeks before you do the surgery. We do the surgery to make sure that the outcomes after the surgery are better than otherwise. So smoking is a big problem. We already mentioned that in most cases, in many, many cases, you definitely want to move as quickly as possible patients out of the bed. So keeping a patient immobilized is a big detrimental factor, period, for any surgery. So you want to make sure that as quickly as you can, as soon as you can, hip replacement, knee replacement, prostate surgery, you name it, you start moving, okay? The provision of sufficient sleep. We already mentioned that maintenance of tissue oxygenation and proper blood flow is critical. And also we need to make sure that we need to either prevent or manage infections as quickly as possible to create favorable outcomes. So this is a really complex slide in the sense that, as we undergo surgery, stress responses, if you will, I'm going to call them stress responses, are activated, and you need to make sure that we create the proper environment to create a balance such that the outcome after surgery is positive. So here we have surgery, which is a controlled injury. Definitely we're injuring tissues. We're replacing a hip. You're going to take a hip. You're going to grab a saw. You're going to pound with the hammer, et cetera, et cetera. It is that brutal. So we create a tissue injury. There's elements of damage. There's inadequate blood flow at that moment. As damage is created, this activates signaling molecules that will trigger inflammatory responses. I already mentioned that regardless of the situation, this is a stress that your body is undergoing. So the whole system activates stress responses. And, we try to minimize microbial exposure risk as best as we can, but sometimes it can be very difficult, if not impossible. So you need to manage that. Sometimes you're going to get, for example, for knee replacement, you're going to get two things from the doctor. One is a special soap to do your washes, your body washes. It's a special soap before the surgery. And also you're going to get a cream, an antibiotic cream that is put in your nostrils to reduce the amount of a particular type of bacteria that grow in your nose that can create problems in your knees. Just go figure that one out. But those are preventive measures for a knee replacement surgery and other like hip replacement and whatnot. So here we have a part of the figure in which we talk about mitochondria. Mitochondria, in other presentations, we cover the topic of mitochondria not only produce ATP, but they can also generate reactive oxygen species, oxidative stress. It's a back and forth system. Healthy mitochondria produce low levels of oxidative stress, which is a good thing. Unhealthy mitochondria, damaged mitochondria that are old because in aged patients, they produce less ATP, more oxidative stress, which is not a good thing for the outcome of a surgery. We already mentioned that typically outcomes tend to be worse in older patients than in younger patients. Oxidative stress is a big trigger of inflammation. So already tissue damage creates inflammation. Adequate mitochondrial function tends to balance these things, but in the context of an injury in an old patient, a diabetic patient, a smoking patient, inflammation levels can be higher, oxidative stress levels can be higher, then mitochondrial ATP can be lower. Again, we would try to hope that we can balance these systems as best as possible to reduce adverse outcomes after the surgery and have our patient be walking a week after hip replacement, like moving on for better outcomes, as we will see in the next slide. So I already mentioned, that excessive oxidative stress and inflammation doesn't favor tissue healing. If anything, it can create more damage. It can compromise blood flow, so that's a problem. It can suppress the immune system. That's not a good thing. It can create problems in other organs. You're replacing the hip, but then the patient is developing some breathing problems. Infection in other organs in the site of injury or away from the site of injury. And then the fact that if things are not going well, typically you have chronic pain, you feel tired, and the recovery is just prolonged. Now, when you have a balanced response, when you're sort of in balance, then you can definitely act on removing infectious agents much more effectively. You can remodel tissues much better. There's controlled inflammation, so inflammation doesn't get out of hand. There's adequate mitochondrial function, production of ATP. Tissue repair and angiogenesis is also optimal. Ultimately, you're going to have faster recovery and much less complications. So this is an important slide because it sort of illustrates the timeline for the rehabilitation medicine that follows, if you will, a surgical procedure and its challenges, okay? So this is supposed to represent time, okay? So let's say hip replacement. Within minutes after the hip is being replaced, the surgeon is going to be very worried both about the placement, etc., but the fact that bleeding stops. That's going to be very critical for any surgery, but more in the ones that are very traumatic. So within minutes, we want to make sure that bleeding is controlled. Within a few hours, inflammation is going to be activated. That's a good thing because healing needs to happen in the context of optimal inflammation, not out of control inflammation. So cells, platelets, etc., get all activated. There's going to be swelling at the site of injury. That's expected, but we want it to be at a control level. Within a few days here, so this is within hours to 3 days, that's what we call acute inflammation. Later on, we start the process of more like longer-term inflammation. Chronic inflammation is necessary and good as long as this is in balance. So here is where the tissues and the blood vessels start to scar, if you will, over, let's say a hip replacement or whatnot. Make sure that everything falls into place, scars into place, heals into place, and that remodeling is taking place in a proper level. And again, this highly depends on also the provision of adequate blood flow. Then weeks and months later on, we continue to have remodeling. We continue to have a process of healing and remodeling, if you will. Theoretically, not as much healing, but more the remodeling of the tissue. So again, within months to several months to a year, let's say, you hope that function is going to be properly recovered, mitochondria are in adequate levels, and you return to an adequate level of function, of baseline function. So this rehabilitation timeline is very critical. I would argue, weeks to several months, in which, to the extent that everything is in balance and we can do things to improve on this healthy balance, that outcomes are going to be better. So again, we talk about here about that we have a environment where there's controlled inflammation, low levels of oxidative stress, very healthy levels of mitochondria, and that tissue repair and remodeling is happening at proper levels such that we can return to proper function. So everybody knows, most of us know of a family member or whatnot, a friend who's gotten knee replacement, hip replacement, and you can see that this takes months for your knee to feel like it's yours and it's not causing any more problems, pain, and whatnot. So it's a process that takes time. Okay, so moving on here, the potential for the restorative effects of epicatechin and how it can positively impact the recovery from surgery. So the following is a partial list of studies published by us regarding the positive direct or indirect effects of epicatechin on surgery-related outcomes. So Dr. Ceballos and myself have published studies in which we can create a heart attack in animals, and to do that, we need to open the chest of the animals. So there's a surgical injury, then we create a heart attack on their hearts, etc. Very impressive positive outcomes from epicatechin. Guillermo has done studies in which a part of the kidney is removed to create an injury in the kidney. Positive outcomes of epicatechin in terms of recovery of function of the kidneys. Dr. Ceballos has also created spinal cord injury in animals by creating a little bit of a damaged spine with a little bit of a impact system, or for that matter, completely cut the spinal cord and have the animals become paralyzed, and then look at how is it that epicatechin positively impacts the healing responses, the muscle responses following spinal cord injury. Indirect studies that are aligned with the concept of us keeping systems healthy for improving of outcomes from surgery. We've done multiple studies in aging in which, regardless of the environment in which the animals may find themselves, just the fact that their age reduces their levels of mitochondria and ATP, bioenergetics, muscle mass, etc. So we improve on those outcomes and those measures by using epicatechin. In the context of animals that are diabetic, we also improve on their diabetic status. Animals that have very severe muscular dystrophy, a lot of damage to their muscles, the animals eventually cannot really walk, cannot really raise their heads or their body to be able to take their food. Again, very positive outcomes. Animal models in which there's a level of toxicity to their biology, like in Gulf War illness, in which again we have positive outcomes on muscle structure function. And studies in humans in which Dr. Guillermo Ceballos coordinated the implementation of a study in Mexico City, where patients that had COVID continued to have symptoms such as fatigue, being tired, inadequate sleep, attention, memory, etc., where many of these parameters improved for the positive, and patients that had long COVID. So again, the body was in a healthier status versus those that didn't have COVID, or their status before they got COVID. Okay, so this sort of summarizes, the presentation for today. I think I give you a sense of how is it that epicatechin can definitely favorably impact the biology of our systems, bodies, organs, cells, etc., such that in the context of surgery, we will expect, again, better outcomes. This is a slide that just has Dr. Guillermo Ceballos, close collaborator, Manny Agrawal, the CEO of FMG Sciences. So ultimately, epicatechin is clearly a supplement that we can take before surgery, after surgery, to improve the health of our various systems, importantly, mitochondria status, energy status, and importantly also the function of blood vessels, which are incredibly critical for healing and recovery from surgery. So more cellular energy from within, Mitos represents, whether or not the options for the proper intake of epicatechin to, like I said, improve outcomes from surgery. Thank you very much.